Good evening, and welcome to this very important Facebook Live here on blackdoctor.org. Now, it's November, and when we think about the month of November, we're thinking about Thanksgiving, we're thinking about Black Friday, we're thinking about spending time with friends and family, especially now that, especially after last year and all the struggles we had last year where we couldn't even go anywhere. This year, we're really starting to get back out. But also, November is very important when it comes to insurance, and that is called the period that's known as open enrollment. And so we work with Black Doctor, and we're always talking about medical conditions and getting healthcare and working with healthcare providers and all this other stuff. But some of these procedures and things that we've been teaching everyone about, they cost a lot of money. And it is good to have insurance to help offset some of those costs. And so this open enrollment period is really, really critical in the lives of millions of Americans, because this is the time where they can either add coverage, change coverage, and do a myriad of things with their insurance coverage. And so we have a special guest to come on and kind of help demystify this open enrollment period that we've got going on. So I'm going to bring him on. This is Mr. Albert Smith.
Hello.
Good evening, Mr. Smith. And we're going to talk about open enrollment. So I hope you got a pencil, pen, paper handy. Take some notes so you can either share it with your friends and family or take some notes for yourself. So before we get started, I want to say, I got 3 requests for you. Let us know where you're watching from in the comment section. So we'd like to give people a shout out of where they're watching from. Number 2, if you know someone that needs this information, tag them and share this information with them, because this is important, because the open enrollment period is not very long, and we're going to talk about that. And then number 3, ask questions. This is for you. So if you have a question or something that you need some clarity on, put that in the comment section and we will ask Mr. Smith. So those are the 3 requests I have for you. With that being said, we are going to get started. All right. So I'm going to ask the first question. Is a simple softball question, Mr. Smith.
Okay.
What is open enrollment and why is it important?
Open enrollment is the time of year when, say Medicare, if you are Medicare eligible, you can make changes, you can add, you can drop coverages, change companies, find out in the particular plan that you're in, because you recently should have received what's called, I'm focusing toward Medicare, your annual notice of change. And in that annual notice of change, certain things have changed, like your medications, your access to certain facilities and doctors. So you need to take a look at your plan and not just accept what you had for last year as you would certain other things like your car insurance. It's not the same. You need to do a yearly checkup of your healthcare plan.
So that you bring up a good point, because I know I just get a notification from my car insurance that they're just going to renew it, and unless I make some changes. Is that the same way open enrollment, or do I have to re-enroll every year?
No, you do not have to re-enroll every year, given certain plans. Plans do change now, and they do drop doctors. See, so that's the issue. You do not want to go to your doctor and all of a sudden he's no longer there, or he sends you a bill because he's no longer in that plan. So you have to, you have to be aware of what's going on.
Absolutely. And so, okay, so now you said Medicare. Medicare is, correct me if I'm wrong, is for people that are 65 and up.
That's correct. 65 and up, and individuals who have a disability for a 24-month period.
Okay.
Who are under 65 and they are on Social Security, they will be automatically enrolled in Medicare. And they have access to all the myriad of plans out there today.
Okay. Now, if you're under 65, you can do open enrollment, but that it falls under what plan?
If you're under 65, it's just everyone in the United States have access to different plans from different companies. All you'd have to do is call any agent. Believe me, they'll come and they'll be glad to any agent that has been certified. There is a difference though.
Okay.
That you have to be certified and licensed in the particular state in which you are trying to sell this particular product. So the individual should look up and find the best what's for him. That's it.
Okay. So you are a licensed agent.
Yes.
Okay. In what states, or just one state, or are you in multiple states?
I'm in 5 different states: Illinois, Indiana, Florida, Michigan, and Georgia.
Okay. So if I need you, I'll reach out.
Okay.
Okay. So somebody is either uninsured, open enrollment, and what is the period for open enrollment? So I guess I know it's in November, but what is the period for open enrollment?
Well, the open enrollment period for under 65 is November 1st. It starts, and it ends December 15th.
Okay.
And for over 65 Medicare is it starts at October 15th and ends December 7th.
Okay. So it's a little bit longer for the 64 Medicare period, and it seems like it's a 45-day period for the Affordable Care Act.
Yes, but
okay.
Assuming what happened last year, it'll be extended. With COVID being the way it is, I think it will be extended this year also, so we can make sure everyone gets covered and get the necessary care they need.
Okay, so what steps does somebody need to take in order to get coverage? They go to somebody like you, or do they just go down to the Medicare office? Like, how does someone get started if they're seeking coverage?
If you're seeking coverage with Medicare, first off, you have to get certain things you need. Okay. Mm-hmm. If you're over 65, you need to sign up for Part A and Part B. And in order to qualify for Medicare, you have to have 40 quarters of work coverage, or 10 years worth of work. And after that, you're okay for Part A. Part B, you have to sign up for. Part B has a premium associated with it.
Okay.
And this year is $148.50. And then you find someone like myself to sit down with you and try to guide you through all the different options that are out there.
So it seems like it's almost like any of you are just getting private insurance. You've got multiple options available to you that you can kind of just go through, and then they sit down with you and you kind of help them navigate what those costs of those plans are, what they cover, what they don't cover. Is that okay?
Yeah, basically what we look at is their medications, their doctors, their hospitals, and the coverage area that they're in.
Right.
And then we'll find what's best for them. And like a lot of people tend to ask me, what's the best plan? There is no best plan. The plan that works for you is the best plan.
Well, that was a question. We got a question earlier from Andre, and he was asking, how do I determine the most ideal plan type? And he was like, for example, HMO, PPO, et cetera. So one, are those options available? HMO and PPO, are they available through open enrollment?
Yes, they are. HMOs are network-based and PPOs are network-based. But with a PPO, you have the flexibility of going outside of your network, but your out-of-pocket costs would be a bit more.
Okay. And so HMO, network-based, you can only see the network in-network doctors, and then they have to refer you out if they have to get a specialist or somebody else.
Exactly.
PPO, you have more flexibility of who you go see, but that is going to be a little bit more expensive, and there might be some out-of-pocket expenses.
Correct. Exactly.
Okay. So I guess the answer for Andre, the answer is what's the best for your budget, and then you have to kind of assess where how your health situation is. And so if you're relatively healthy and have a lower budget, HMO might be you could save some money by going with an HMO plan. If you like the flexibility of choices, PPO plan might be the way, but you're gonna have to pay for having a choice.
Speaking of choices, there
Yes,
is
sir.
another option.
Okay.
The option is you can get what's called a supplement and keep original Medicare and just get a Part D plan to cover your medications. So you do have some options, and you can go pretty much wherever you want. But any doctor that takes Medicare will take that particular plan.
Okay.
And all companies out there today have pretty much the same standard supplement out there. And the only difference in the supplements pretty much is cost.
Okay. So, and I think this is a question. If somebody has private insurance, can they still get open enrollment?
No.
Can you have private and open enrollment? No. Okay.
No, just no. It's not allowed. It's just flat not allowed. Okay. I have run into individuals that have had, I'm talking about Medicare now. I have had two separate plans together, but they was not supposed to have it. And whoever set it up was subject to some penalties, to say the least.
All right, so we don't want to get anybody in any trouble. So the answer is
want to head it out there.
We don't want to plant any bad seeds in anybody's mind. No. So
can I say one other thing?
Sure.
No one should be calling anyone this time of year. As far as Medicare is concerned, I have clients out there that they come to me and they said people are calling them about Medicare. Medicare is one of the rules you do not call. Salespeople are not supposed to be calling you.
Okay. So just for everybody to know, so if Medicare is calling you, somebody's calling you and saying they're representing themselves as being from the Medicare office, they're probably not from the Medicare office because they should not be calling you. Okay. Now, when you get the packet, now is that true also for ACA, the Affordable Care Act?
No, they can call you for the ACA. Okay, and they really should direct you. They actually, depending on the agent you're working with, you can call healthcare. You can go online, healthcare.gov, and you can get somebody like myself to help you. They have a program out there today where they'll, if you get stuck, it's called Help Online, and they'll direct you to an agent on there. But Medicare.gov is the place to go to start. You're looking for ACA. Okay.
All right, so I put the site there on the screen, healthcare.gov, if you're looking for, and that'll give them the general information about ACA and what plans are available to them. Now, I saw that online when I was doing the research is that there are certain things that the plans have to cover. What are those things that the plans have to cover?
It's called preventive care services. It's like your mammograms, your colonoscopies, and your general range of tests. I think there's about 20 some different tests that are at no cost to you.
Okay.
So, and it is part of the plan. The way it's structured is structured to keep you healthy, to find out and catch your disease, if there's a disease, condition there, to actually get you help early, to keep you healthy and alive and out here with us.
Okay, so that makes a lot of sense. I'm gonna clarify for the folks that are just starting. There's like 20 something preventative kind of services that they pay for, and that's at no charge because it's lower cost to prevent an illness than it is to pay for it once you get it.
Exactly.
And so that's really what the whole thing is. And so they're encouraging people to get their mammograms. They're encouraging people to do their regular prostate exams. They're encouraging people to get their colonoscopies and things of that nature to ensure that they're still healthy versus, waiting and then you could have a more serious illness like breast cancer or prostate cancer or colon cancer that is going to cost more to treat and to come out. Okay,
exactly.
So, and I think it's important for our audience to recognize that, because we're always talking about eating right, exercising, getting proper rest in order to prevent illness, in order to lower. And so what we're talking about with open enrollment and these plans they're paying for the preventative services at no charge. So you can supplement what you're doing at your home and getting yourself healthy. You can supplement that by having no cost preventative services done through your Medicare or and is that also applicable to ACA? Because I know there's a lot.
Yes, there is. Okay.
All right. So the $50 million question, and I know this was a big hot political topic. If you have a pre-existing condition, diabetes, high cholesterol, hypertension, any pre-existing condition, a previous bout with cancer, can you get covered?
Yes, you can get coverage. There is no hindrance to getting coverage at all, especially in Medicare.
Okay.
They cannot not accept you.
Okay. So, and Medicare is for people 65 and older.
65 and older, and those who are disabled.
Okay, I want to reiterate that. And then, so if you're under the age of 65 and don't have a severe illness that you've had for over a 12-month period, 24-month period, then you're going to be qualified for the ACA. And there's some similarities between ACA and Medicaid, but there's also some differences. Can you help people kind of understand, other than the age, what are some of the differences between Medicaid and the Affordable Care Act? Medicare, sorry.
Okay. Yeah. Medicaid is a different animal altogether. Okay. Medicare and Medicaid is just, the difference is the plans. That's basically what it is. And you have with the under the ACA, you have your different plans. If those out there that have gone out and looked, you have your gold plan, silver plan. It's all about coverage and what kind of coverage you want and the deductibles associated with it and the copays. So it depends on how much out of pocket you can afford, and how you can maneuver getting what you need to satisfy your healthcare needs. Now, the difference with that is in Medicare, there is no silver and gold and different metals, as they call it. It is only different companies which provides different things and different additional things associated with that, like hearing, vision, and dental coverage. Some have more than others. So,
okay. Now, these plans, whether ACA or Medicare, I want to make sure I say that right, they are backed by private insurance companies?
They are backed by private insurance companies, all of them. My way of explaining it to my clients is that, okay, if you just use the government's way of doing it, just open original Medicare, okay. You have the flexibility to go anywhere you want to go. But then now you're getting billed, the government is getting billed everywhere from each one of these different providers that you have, and there's no coordinating care. You can go to 4 different doctors, and 4 different doctors could treat you for the same condition. Now you got you could get the four conditions. For the same condition, 4 different medications, and you see how that can compound things.
Right.
So with a coordinated plan, as Medicare has put down with these private insurance companies, okay, you get a primary care physician who coordinates your care, and he's the one responsible for you and making sure you stay healthy, so the government does not incur that additional cost like it was happening back in the past for all the billing and the whatever was going on out there.
Right.
So
I can see some fraud can happen in that situation where you've got multiple. It's too many people, because the government's going to just be paying checks and they have a hard time being able to coordinate. But now you've got and this is for Medicare.
Right.
Is that also true for ACA, that you've got one?
They ask that you do it. Yes. They want you to have a primary care physician because I call it the quarterback of your health care.
Okay.
He or she, that person is responsible for making sure you go and get your testing and and pretty much just keep you healthy as much as possible, and to provide, comfort. You'd have somebody, one person versus going. I have sat down with individuals and what they have decided to stay at a plan that did not provide the services that they really needed because they just wanted this particular provider because their cousin told them this was what they should do.
Right.
No, it's not the way you do it. You should look at your coverage, find out what your needs are, find a person that can help you get where you need to be.
Right.
Health-wise.
It's interesting. I was thinking about this. I was like, man, so I'm sure, in your role, you've seen it all. So kind of help our audience understand what are some of the things that they should avoid. What are some of the pitfalls and things that they should avoid when they're going through this open enrollment period?
If you sit down with someone like an agent, and he doesn't spend 30 to 40 minutes with you asking you what you presently have today and explaining to you exactly what medications are in a particular plan and how much they cost and your particular hospitals associated with it. And he doesn't take 30 to 40 minutes to understand your needs, then you need to find someone else.
Okay.
And I don't think you should depend on the 1-800 numbers that are out there. And
Okay.
There's quite a few of them out there right now that they're promising you a lot of things that are not really as it seems. Like right now, I'm hesitating to I don't want to bring up names and say certain things.
Right. I get you. Sensitive names.
Yeah, it is not as it seems.
Okay.
Do not trust a lot of things on there. Find somebody you can see and touch and ask questions.
Okay.
And if he doesn't satisfy what you need, find somebody else.
Okay.
That's it. It's just there's a lot of, I just call it chicanery out there nowadays. People trying to make instant, quick money. And the idea is to keep your clients happy and healthy.
Okay. Well, yeah. So basically, the person that you sit down with to talk about your plan, that person should spend time explaining to you what is part of that plan and what isn't part of that plan, what's covered by that plan and what isn't covered by that plan. So you can have a kind of a good understanding. I mean, you will have to have that information. Say you need to have an agent or a broker that really is going to explain that plan to you. And if they're not doing that, then maybe you should find somebody else to help you out.
Right. Because you need to have some flexibility in what you're doing. Because if you find you need a broker, you don't need an agent who has one plan. If you understand what I'm saying, you have all he is a company. He has one company he has allegiance to. So he's going to try to fit you in that plan.
Got you.
See, you need to go find a broker who has no allegiance. All he's interested in is you, to make sure you get the best care for you. Because there's, as far as our compensation, we get the same for every company. It doesn't matter. They eliminated the mix of compensation they had years ago. So.
Okay. So a broker has multiple companies, multiple plans available to them, and then they're going to help you decide what's the best plan for you versus an agent. An agent has one company that they represent, and they're going to find a plan in that company's offerings that you can fit in.
A captive agent. I shouldn't correct that. A captive agent.
a captive agent. Okay, so that's good. A good distinction. You know, there's a broker, multiple plans, and a captive agent represents really one company. And so it really is about what's best for you, and you need to find somebody that can find what's best for you.
Correct.
Okay. It's a lot. All right, so here's another $50 million question. What if somebody misses it? Let's say like they miss the enrollment period. It gets to be December 8th and they forgot they didn't enroll in Medicare, or it gets to be December 16th and they didn't sign up for the ACA. What happens then?
Well, at that particular time, with Medicare, you won't have coverage until you sign up. Now there isn't an enrollment period for Medicare. You can sign up, but if you don't have a lot of options. To tell you straight up, if you don't, you don't have a lot of options. You have to wait to the next period to sign up. That's what it is.
Okay,
there is what's called a general enrollment period in January that you can sign up for Medicare, but it doesn't go. It won't be effective till the next July. Till you sign up in January, and you won't even get coverage till you get it's July. So you will wind up with no coverage, and then you're subject to penalties.
Okay.
For no coverage.
Oh, wow. Okay. All right. So
yes, there are penalties associated with that.
So they're going to penalize you for not having coverage.
Yes.
But if you don't have coverage,
you didn't sign up.
You have to pay for anything out of pocket.
Yeah.
Isn't that penalty enough?
Yes, it is. But if you don't sign up when it's your time,
right,
to sign up, for every year that you go uncovered, you get penalized for certain things, and for every month, that's for medical coverage, and for every month that you're not covered as far as your medications, you're penalized. Yeah.
Okay.
Yes, it's two different ones.
I get that. Okay, so let's talk about cost. Like for Medicare, is there a cost for Medicare, or is it just you just sign up?
There is a cost. Different plans have different costs for it. You have zero plans, and you have some plans. As far as I know, some have a premium up to a couple $100. Right. It depends on what's included within each particular plan.
Okay.
Yeah, there are a lot of zero premium plans out there, but you have to look at the fact that yes, it's zero premium, but there are co-pays and co-insurances associated with it. The plans.
Okay. And see, this is what I'd like to consider myself to be a smart man, but this gets complicated, right?
Yes, it does. I've been in it for a while, and I have to really slow down and think about each individual situation when I sit down with a client and kind of maneuver my way through it to make sure I provide the services that they need versus trying to just throw a one fits all thing to it. And it's complicated. It just is.
Okay. Yeah, and I think so. Let's try to make it on. All right. So we've handled, and if you're just joining us, we're talking to Mr. Albert Smith. He is a broker for open enrollment. That is primarily what you do in terms of. There was somebody who was asking for your information, so we're going to make sure we're going to give them your information so they can reach out to you if they need your help. So what we have learned to this point, and stop me at any point if I got this wrong, the line of demarcation is 65 for healthy individuals. I'm assuming for healthy people. 65 and older, Medicare. under the age of 65, you will be signing up for the Affordable Care Act, also known as Obamacare. But we like to call it Affordable Care Act because that's what it is. There is a distinction. You can get Medicare under the age of 65, but you had to have a serious illness for at least 24 months, and you can apply to get an exemption, and then you can get Medicare and Social Security as part of that. So like children that have if you have a childhood cancer or something like that, that might qualify. Children that have severe like cerebral palsy, severe medical illnesses, then they would also qualify and get Medicare under the age of 65. But primarily 5 and up, 5 below. They do not disqualify you for pre-existing conditions. So you can come in with pre-existing conditions, and there are some provisions, some services that are at zero cost, and they are preventative services. There's a list. You can find that at healthcare.gov and find out that list of preventative services they pay for, like mammograms, prostate exams, colonoscopies, things of that nature, preventative services to make sure, because their goal is to keep you healthy so they don't have to pay for the more serious kind of surgeries and things like that. So they rather pay for the screening instead of having to pay for the actual colonoscopy and all those other things. And so, all right, so that's where we are. Also, understanding that these plans are backed by private insurance. So Aetna's and all those companies, they are backing these plans, and there's a distinction. Much like private insurance, you can get an HMO plan, and that is where you get a list of people. They say you got to go see these people on our list in order to be covered. And then there's PPO plans, but those PPO plans do have an additional cost associated with them because you have the flexibility of being able to choose your provider versus having one being selected for you as a primary care provider. And that primary care provider serves as basically your healthcare guru, for lack of a better term, your healthcare quarterback. And they handle, and they're the ones that you go and you see, you get your checkups, and your physicals, and then they start saying, okay, I think I think you need to go see a specialist for this, and then they refer you out to those specialists in order to get those other services performed, take care of. How am I doing?
You're doing great. I tell you, you put it in a very logical order and made it very clear. You know what I mean? Okay. Versus,
great.
A lot of things running around. Exactly.
Okay. All right. So there's a question from Sylvia. She wants to know, what are the basics? She said there are 5 parts to Medicare.
5 parts? No, there's 4 parts basically to Medicare. There's A, B, C, and D. Okay, A is your hospital facility. Mm-hmm. B is your physician, your nurses, your doctors, right?
Yeah.
And C is actually I hit brain freeze right quick. Okay. But they take care of your medications.
Okay.
See? Yeah. Okay.
It'll pop in. I have it happen. It happens to me all the time. So there's 4 parts: A, B, C, and D, basically. Okay. Right. All right. A, B, C, and D. Okay. So thank you for joining us. I appreciate that. So make sure, and I'm going to just reiterate, if you have any questions, please put those in the comment section, because this is what this whole session is for. We got one-on-one. Mr. Albert Smith, he is a broker. And so he has no allegiance to any company. He is here to help provide answers and help you through the process of open enrollment. Open enrollment for the Affordable Care Act began on November 1st, so we are now on November 10th. So it's been open for 10 days. And it is typically scheduled for 45 days. So that will lead up into December 15th. But after, since we're in the pandemic, the thinking is that that period will be extended, but don't count on that, folks.
Don't count on it at all.
Don't count on that. You have 45 days for ACA. The open enrollment period for Medicare has been open a little bit longer. It opened at the end of October, and it's going to run through December 7th.
Correct.
And so that period is a little bit longer. But again, there's probably going to be some sort of extension as a result of, but again, don't count on that. So please, 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 if you haven't started the process yet, contact or find somebody in your area if you're not, because he's certified in 5 states and there's 50 states. So I know he can't help you everywhere. He can help you in his 5 states. He can help you in his 5, but you can find a broker in your state and look to get the information that you need in order to enroll. Because as much as like Doctor, we're all about helping people get healthier, and one of the things is being able to get the services that you need taken care of if that time comes, and that's where insurance comes into play. And so you really have to have a relationship with a health provider. And so open enrollment period is a way for you to do that. So,
and a little clarity. Okay, there's only 3 parts of Medicare. It's parts A, B, and D.
Okay.
And maybe she was talking about having the option of a supplement.
Okay.
And there are different parts or plans inside supplements, and that could be, there's about 8 different plans inside of supplements. That could be where she's got the 5 or the number 5 from. So
okay. So A, B, and D.
Yeah,
in terms of Medicare. And then underneath those, there's supplements.
You get a supplement that augment your Medicare, original Medicare, and tie it with a Part D plan to cover what A and B does not cover, because there's co-pays and co-insurances associated with A and B.
Okay.
Yeah,
that's what it really.
I try not to, to put forth all this information on a client when I sit down with them.
Yes.
I try to stay as high level as I can, and I use pictures.
Okay.
So that they understand, because I tend to start talking fast, and it just I tend to lose them when it lose my client, and I cannot do that. And I'll go back over 3 times, 4 times as necessary till they understand what's in a document, because I usually have a document in front of me, actually going over it, and I had drawing pictures and things like that to make sure they understand. And until they understand, I cannot sell them anything.
Gotcha.
And that's the purpose of having a good broker, is you do not just sell. You make sure you get understanding. Once they get understanding of what they're doing, then now you can go forward, and they can always find your name and number to call you and ask questions.
Okay. So when I was asking you earlier about pitfalls, I think that's one of the most important things. If you're going to utilize a broker, you need to have one that is, because you don't have to just pick the first one. If you go to a broker and they're just kind of rushing you through the process, trying to put you in a plan and get you out the door, that might not be the broker for you. You might need a broker like Brother Smith here, that's going to sit down with you and make sure you understand it and help you pick the right plan, that is the plan that's best for you and your family. So I think that's important to note, that remember, you control this process.
Correct.
This is your insurance, your health. So you drive this process. So just because you called somebody and had them schedule a meeting, whether it's on virtual meeting or whatever, with them, doesn't mean you have to go with them. Doesn't mean you have to use or go with their recommendation. You have to go with what you feel comfortable with and what's best for you and your family. So always, please recognize that and remember that as you start this process of open enrollment. Okay, so what are some of those key, most important things that a person should know about their coverage? What should everybody know in their head about their coverage? Some 4 or 5 things that people should know. My coverage does this, it covers that, it covers this.
It should cover whether I get, like I stated, the list of tests that's there.
Yes.
Okay. It should, how many times should I go to the doctor, and
Okay.
and do I have and actually check out your doctor. Just because you've been going to this particular doctor for however many years doesn't mean he's the best doctor for you. Check him
Okay.
out also. Make sure you do your due diligence. Find out, the people you're working with and the hospitals you're dealing with.
Right.
That is what you need to do. And don't just take anybody's word for anything. This is, like you just said, it's your health.
Yeah.
You have to know what's best for you. And is everything, sometimes it's not just the plan itself
Okay.
that you need to look at. You got to see, maybe you have to find out if there's any flexibility in your plan. Call on the back of each card that you do get, there are options there. And if there are extra additional things there that you can utilize, like the gym memberships to keep you healthy, what's the additional stuff out there that you can utilize to like seniors tend to, how would you say, self-isolate sometimes.
Right.
Now
Right.
you gotta socialize. Some plans offer you access to organizations where you can actually get together with individuals. It's a social. You got to think about the mind and body.
Okay.
So you got to understand. You got to put everything together in order. You got to make sure you take care of the whole you.
Okay.
That's.
I think that's very important to recognize that there are other services that are part of these plans.
Correct.
And so find out what those services are, whether it's a gym membership, whether it's some social interactions. I think it's also, I think it was really good that what you said about researching your doctor that they give you, right? So if you have that HMO plan and they say, okay, here's your primary care physician, and you do some research on them, you can request to have a different primary care physician
every month.
And so you don't have to just go with the person that they give to you. So that's number 3. Always know what your plan covers and what your plan doesn't cover, right? Understand those preventative services, know what it is. And if there is an additional cost, know what that is. So you're not blindsided when you go to the doctor's office and they send you a bill. And you say, wait a minute, no, because that wasn't listed under the services. And so those type of things, keep yourself a notebook. If you have to, take it with you. If you've got a card or something that you can't remember all that in your head, I think it's really important that you have that information in a folder that's readily accessible to you or somebody that's in your family if you are incapacitated, to where they could pull that information out and have it prepared. So if you do have to go for emergency services or something like that, you already have that information, because that's the first thing. That's part of the triage process. I've worked in hospitals before. That's part of the triage process. When you get presented, whether it's emergency room or not, somebody's going to have to talk to what's your financial situation. Do you have insurance or not? And sometimes it's after the fact if it's an emergent situation. But if it's not an emergent situation, first thing you're going to do is you got to talk to that lady behind the desk and find out what your insurance is. If you don't know what it is, then that's already going to put you behind the 8 ball. All right. Okay. So this is a lot. This is a lot, but this is really good. So we've got some. I'm trying to make sure. All right. You talked about it, and I think one of the things we need to reiterate for this particular at this point in time is that, people ask you what's the best coverage, and you said eloquently earlier. What was your answer?
There is no best coverage. What is best for you? You have to find out what fits your needs. That is the best. There's no such thing as a best coverage. It's what's best for you. And the way to do that is to sit down and find out what your needs are first. Your doctors, the hospitals, your medications, and just how you feel about plans and what additional plans. Like I ask, like certain people that they're healthy, like myself. I just go with myself. Okay, you're fairly healthy. You don't have to go do a lot of things. What I need is gym membership or dental vision care. So, and how much do I need? Okay, if I need a lot of dental work and I'm healthy, okay, there are plans that have different, it's called additional services, but it's there for your utilization. You don't have to stay with that same plan all year for the next year, but you can get coverage for a year, do what you need to do. And if it's good, if the medical coverage is good for you, you can stay. If not, you can move. You're not stuck in any particular plan, and you have flexibility. Don't ever think that you're stuck. Like you were just stating, you can change your doctor at any time. If the doctor's not providing the coverage or the services you think you need, then change them.
Okay.
There's a customer service number on the back of every card that you get. Even you can call Medicare and get some instant coverage change. You know, I've counseled some clients to do that, you know, because they were moved in the middle of the year. So you're not ever stuck. It's options. Just think about that. Options. You have options.
Absolutely.
So use it. I'd say use the plans. They're there for your utilization. Use them, and don't always think that they cost you anything. Like I can't afford that. Yes, you can. It beats other things, doesn't it?
Yeah.
It beats, you know, I won't say it here, but you got to stay healthy.
Yeah.
The way I say, stay healthy, stay out of the hospital, and take care of yourself and enjoy this, because we've been locked up for what, 2 years now?
20 months, pretty much 2 years.
So it's time for us to get healthy, get better, and go see our doctors, see them regularly, get our checkups, do what we need to do, take our medications if we need them, and get back into the gyms and get healthy again and get out there and enjoy the world.
Well, you got me inspired. I'm like, I need to go make sure I got all my coverage. Like I need to make sure.
Go get it. It's right there. And I was not going to say this, but a lot of this coverage, you're paying for it already.
Okay.
There are a lot of people out there, especially the over 65 group. Now, okay, they are paying for what's called Part B of Medicare. They're paying for these plans already. And they have the idea that they're fully covered. They are not. There are holes in Medicare. Part A has copays and copayments and deductibles, right? And Part B only covers 80%.
Oh, okay.
20% unlimited. As I was just stating earlier, sitting down with a client, if you have $1 million bill that comes up for some catastrophic illness, okay, 20% of that is what? 200,000?
Yeah.
It comes out of your pocket. Now, these plans limit that. There's a floor. These plans are out there that you're already paying for that limits your out-of-pocket for your costs, and picks up the copays and picks up the deductibles as part of Part A. So look into it. Don't assume that you're covered because you got a red, white, and blue card. I'm mostly a Medicare person. You know, ACA, I just got into it a couple years ago. But as far as Medicare, I've been doing that a lot longer. And I see, I've sat in venues, places where folks were there, and they walk by and say, "I'm covered." And when we're not supposed to talk, grab people. We can't just walk up to people and do what we have to do. So they say, "I'm covered." But when they talk to you, you can talk to them, and you say, "How are you covered?" And they'll say, "Well, I got Medicare," and then I ask, "What else?" And then my next response is, "What do you mean?" I say, "What else? What other coverage do you have?" They say, "Well, I got Medicare." I say, "Do you understand what I just stated about the 80%? I tell them that. And they look at me and they don't understand. I say, "Well, find an agent. If you don't want to sit with me, find an agent. Find someone that can cover that hole in Medicare that you're leaving yourself subject to. You need to go and take care of your coverage. It's there. You're paying for it.
And I think this is an important point that you're making here, Brother Smith, is that the number one reason people go bankrupt in this country are for healthcare bills.
Correct.
The number one reason. And so if you get caught in a situation where even if you've got insurance, but they're not covering that 20%, and you can't afford that 20%, or if you don't enroll during open enrollment period, where we're in the middle of it right now, and you don't enroll, you say, I don't want to be bothered.
Correct.
And then something happens, that could set you and your family back for generations because they don't, even if you pass away, those bills pass on to your family.
That's
and
true.
then the bills will go away. Okay, somebody else is going to be held responsible for them. And so what you've got to make sure is that you're covered, that you cover your family. And by doing it, and if that is just understanding these open enrollment. Okay, so we got a question here from Audrey. She says, please speak on Medicare Advantage
plans. Okay, Medicare Advantage plans, that is pretty much my expertise. Medicare Advantage plans, what they do, they have co-pays and co-insurances associated with them. Now, at this, each individual company has their own rates. A lot of them, like I stated, they go from $0 to $100, just say $200 on average for a premium. Now, usually, I'll just use an example. I can't go into detail about what these plans are, but they do have a floor. The maximum out of pocket is set at a certain level. Now, Medicare.gov, I think this year, the maximum out of pocket, as I was about the $20,000, is $7,000. So if you had a catastrophic illness, the max, if you had one of these plans, $7,000 that will be what you would have to pay, period. That's it, is in any 1 year. It limits your maximum out of pocket. It provides parts A, part B, and part D inside the plan. And that is what an HMO pretty much is, and a PPO. Now, they have other plans, but pretty much they're not in my area. They have a private fee-for-service plans and the cost plans and that kind of thing. But a general Medicare Advantage plan itself covers A, B, and D. Some generally, they do have other plans out there that don't cover the D portion. They're still called Medicare Advantage plans. But Medicare, I'll say it one way, Medicare Advantage plans and or Medicare Advantage plans with a Part D, MAPD plans. So just say Medicare. A short answer is a Medicare Advantage plans covers parts A, part B, part D, and limits you out of pocket.
There it is. There it is. That's a good summary, because you start getting out, say, whoo. Well, and truth be told, I think this is why it's such a struggle for folks, because it does get complicated, and there's stipulations for each one, and then you start and you've got to make a choice. And so when you're saying, okay, and you start laying out all these different choices, but if you got this, you got that, and it's like, wow, it becomes overwhelming. So I think, and correct me if I'm wrong, I think what would be good for somebody before they even talk to a broker like yourself is to write down what their needs are, right?
Exactly.
Write down what your needs are. Okay, if you know you've got a medical condition, so okay, here's what I'm going to need. I'm going to need my medication covered. I'm going to need to get regular checkups. So you need to know what you need before you start going through this open enrollment period, because you sit down with Brother Smith, he's going to ask you, well, what do you need? And you're going to have that blank stare on your face.
Right. And
then that becomes a harder conversation, because now it becomes a fishing expedition.
That's exactly what happens.
Okay. And so now the key is to, if you write down what you need, here are my basic needs for myself, if I'm alone, or for myself and my spouse, or for myself and my family, have all those needs written down. If you've got small children, if you're going for an ACA, and you've got kids under the age of 18, school-age children, what they're going to need. They're going to see a pediatrician. They got to go see the dentist. They got, there's some basic things that they're going to need. Now if you have it all written down, you go see Mr. Smith. Now y'all can have a real conversation, and then you can move forward to, okay, these plans will cover all of those needs, and then this plan will do this at this cost, and then this plan will do it at this cost, but it adds this,
Right.
as an extra benefit. And now you can have a more robust conversation because you basically established what your needs are. So that's just kind of having this conversation and thinking about like what would make it easier. I'd be like, I need to write down what I need so I can have a basis of understanding to be able to go through and navigate all of this, because this is a challenge. And so that's why we're having this conversation. I want to thank, wow, it's been an hour already, but I want to thank Brother Smith.
Okay.
Scrolling on the bottom of the screen is a guidebook that we have on blackdoctor.org. It's a Medicare guidebook. So please, after this conversation, go download that guidebook. Take it with you. It just gives you some general information, some of the things that we discussed here tonight. Download that guidebook, and that will help you get through this open enrollment process. I also put it in the comment section, so all you have to do is click on it, and it'll take you directly to the guidebook on our blackdoctor.org page. Make sure you go and download that, because that will help you answer some of those other questions. Mr. Smith, people that are in those 5 states that you talked about, I think you said Illinois, Indiana, Florida, Georgia,
and Michigan.
And Michigan. Okay, I got 4 of the 5. So
Michigan. Okay.
I got an 80. So Michigan. So if you live in one of those states and you want to get Mr. Smith to help you broker through this open enrollment period, how can they get in contact with you?
They give me a call at 708-870-7734.
Okay, 708-870-7734.
Yes.
Okay. I'm going to put this up on screen here. So if people want to get in contact with Mr. Smith, that's the number to call, and you can set up an appointment with him, and he will kind of help you. You heard it, what it is. He knows what he's talking about, because he's able to keep he was keeping me straight, because I said Medicaid, and he said, no, we're not talking about Medicaid. That's a whole different thing. We're talking about Medicare, and we're talking about ACA. So if you live in one of those 5 states we mentioned, call Mr. Smith, and he will help you get the plan that's best for you and your family. So thank you again, Mr. Smith. I'm going to invite you. This is just part 1. This is just part 1. In a couple of weeks, we're going to have part 2, and we're going to have a panel of people on to kind of talk about and help you navigate through this system. We're going to have some healthcare providers. We're going to have some representatives from CMS to come on. So we're really going to go more in depth on our panel in 2 weeks. So check us out in 2 weeks as we go through part 2 of open enrollment. Again, December 15th is rapidly approaching. December 7th is rapidly approaching. Do not get beyond those dates without enrolling in some type of plan. They will penalize you if you're not enrolled in a plan. As we talked about tonight, you will be penalized if you do not enroll in a plan. And you can still enroll, but they're going to penalize you in January. And you don't want any more penalties. You don't want to pay any more out of pocket than you have to. And it could just have been as simple as you enrolling during open enrollment period. So make sure you please do that. December 7th, December 15th. Those are the 2 key dates that you need to have in your head. So again, Audrey said she's in Florida. She's going to be calling you. So
that'll work.
So got your customer. So again, go to blackdoctor.org and check out our Medicare guide. If you're in those 5 states, call Mr. Smith, and check us out in 2 weeks again as we have this conversation again about open enrollment. Thank you all for joining us, and we'll see you next time.
Thank you. Appreciate it.